Corla. And as I've already alluded to, ordinarily I begin by welcoming any opportunity to update this House, but today I cannot do so. We are living in extraordinary times, and what we do ordinarily is no longer a choice that we can freely make. I particularly think on World Autism Day, which is today, of the people in our country who most depend on routine in their lives, now finding their way to cope with their families in what is very strange and difficult days as they seek to play their part in our national public health emergency. I think of all the people at home who are adjusting to what is a very, very different way of living. And just like them, I genuinely believe democratic accountability can operate at a distance, and there's no reason it cannot do so effectively. Other parliaments around the world are doing it. Many members of the opposition again questioned the HSE remotely at a briefing yesterday, and many will rightly question the Taoiseach and myself in the same way later this afternoon. So I won't dwell on this any longer, but I do believe that days we do not lead by example are days we should regret. Ceann Comhairle, I'd like now to express my condolences to the family and friends of all those whose lives have been tragically taken by this terrible virus. And this virus does not just steal lives, it even steals from us the very cherished ways we grieve in this country. 22 days ago, we had our first death from COVID-19. And as of last night, 85 men and women in Ireland have lost their lives. This should give us a singular focus. We must protect the most vulnerable members of our society. Earlier this week, we moved to strengthen our support to people in nursing homes, people working in home care and depending on home care, and other long-term residential care settings. I've also been reaching out to organisations who represent other vulnerable groups, including people living with cancer, people living with addiction, and people living with poverty. We are all affected by this crisis, but some people are more affected and more vulnerable, and our watchwords must be that no one will be left behind. This national effort must be driven by our instinct to look after each other. That is what we want to do as Irish people, and that is how we will prevail. All of us can help to protect our loved ones, our families, our colleagues, our friends and our neighbours. Many of the ways we usually show our love and support are currently closed to us, but we have to open to us an opportunity to make a real difference. Our people are already making that difference. When we first started to trace the contacts of confirmed COVID cases, people had been in contact with about 20 other people. 2 weeks ago, that was reduced to 10. 1 week ago, it was reduced to 5. And today, it stands at just 3. We know that the truth is that the number of cases will continue to go up. But the truth is also that the rate of growth in new cases has gone from 33% to 10%. That is still too high. Let's be clear on that. That is still too high. But we are showing as a people that we can do this, and we can do more. We can see some of the impacts of the measures that the Taoiseach announced on the 13th of March and the 24th of March already. But we've not seen the full impact, and it's too soon to really see any of the impact of the extremely difficult and restrictive measures we announced only last Friday. But the message people need to hear is, you are already making a difference. And if we now all redouble our efforts, we can lower the growth rate more and more and save more lives. But let me be clear on this. Let the Irish people know this, because the Chief Medical Officer believes it and says it clearly. There is no doubt that through the countless efforts of so many people, lives have already been saved in our country. The work that you're doing, sitting at home today, not going to work, having the kids off school, restricting your movements, good washing of your hands, good cough etiquette, that is saving lives. You've already saved lives, and we can do more. Our Chief Medical Officer is clearly telling us that the number of cases is far less than it would have been in an unmitigated epidemic. But let me be really clear. This shouldn't in any way confuse any of us in relation to what we need to do, because there can be no cause for complacency. Rather, it's a call to arms, if you like. Keep at it. Do even more if you can. Stay the course. Stay at home. We all have to help our health service in planning for what lies ahead. Our health service staff are making huge personal sacrifices in the face of this virus, along with many other workers on the front line. I know the House will want to join with me, Ceann Comhairle, in again paying tribute to our health service personnel, our doctors, our nurses, our ambulance personnel and paramedics, our care workers, our cleaners, our porters, our caterers, our medical scientists, and all those working on the front line response to COVID-19, and others working on the front line in terms of keeping our supply chains going, keeping us fed, keeping product being produced in our country, keeping vital public transport going to get workers to and from work. I'll now update you on some of the key actions being taken as we step up our efforts to contain the spread of the virus and mitigate the consequences across society, and particularly in our health service. We are making sure that we do everything that is humanly possible to prepare our acute hospital system to deal with the increased demand that's no doubt going to be placed on its capacity. Deputies will be aware that the City West facility is now open. It's a self-isolation facility with 750 beds. There will also be 450 step-down beds at this facility. And we're opening similar facilities in other locations right across this country. I want to say the work that the HSE did in securing this hotel and putting this system in place so quickly is really quite incredible. They had their first 16 patients check into that facility last night. This week, we also concluded a very important agreement with our private hospitals, which will increase the capacity of the health service in Ireland by 17%. It provides us with an additional 2,000 hospital beds across 19 hospitals, including, crucially, a further 47 ICU beds, more high dependency beds, and 194 ventilators. The HSE is engaging on a daily basis with domestic and international suppliers to secure additional ventilators to meet the anticipated surge in demand. Procurement of these and other essential supplies is an ongoing challenge for all health systems, given an unprecedented global demand. This is a global pandemic. Every country is looking for the same products, the same supplies. And Ireland has therefore decided to join with other member states in the European Union as part of a centralised joint procurement of essential medical supplies. The EU Commission is currently preparing contracts for each member state to distribute the supplies in the coming weeks. I'm very conscious, Ceann Comhairle, of the current focus on testing, which is of course very understandable. But I do have to reiterate the advice of our public health experts. If you have symptoms, you should self-isolate for 14 days, and members of your household should do likewise. You do not need a test to follow this advice. Having a test does not affect your need to self-isolate. The purpose of testing is for public health surveillance and tracking purposes. The test does not change your treatment, which should and will be based on the advice of your GP. As you know, the National Public Health Emergency Team, chaired by the Chief Medical Officer, recently recommended a change to the case definition being used to identify people suspected of having COVID-19. This decision was based on a need to more carefully target our testing regime to ensure we are testing those most vulnerable and to help prioritise the testing of our healthcare workers. This has been somewhat effective, as we're now seeing the rate of those testing positive increased from 6% to 15%. In other words, by having a more targeted approach, we're finding more of the virus. While we now have over 40 testing centres in the community, in recent days it's very clear that testing capacity has been constrained due to a number of challenges that we have in common with every other country and which the HSE is truly working hard to address. But it's really important to stress that we're still testing more than most other countries. At 6,000 tests per million people in Ireland, we are still near the very top of the league in terms of the amount of testing being done in any country. But we're going to ramp this up further. That's the right strategy to take. The HSE has indicated that it now has sufficient test swabs, and more orders will be delivered in the coming days. The HSE has also been making every effort to procure other stock, including sourcing domestic production of reagents. And it's also plans to expand testing capacity. In addition to the National Virus Reference Laboratory, 12 hospital laboratories are also now testing for COVID-19, with additional facilities due to come online. The expansion plan will also focus on increasing lab capacity in other settings. Plans for this expanded capacity are well developed, and arrangements are being put in place with the Department of Agriculture, Food and Marine for the use of its laboratory space. Current laboratory capacity stands at 1,500 samples per day, but it absolutely remains our national aim and intention to expand to up to 15,000 tests. We will continue to provide regular updates to members of this House and to the Irish people as these operational measures move further, as well as to our wider work. But I do want to recognise in this House that a testing system that has to be sustainable, not just for today or tomorrow, but for the weeks and months ahead, has been set up by the HSE in rapid time. It is true that pinch points have arrived from time to time, and they are working flat out to address them. These are challenges that are shared with other countries, but I'm happy that additional capacity is due to come on stream. As I've already mentioned, Ceann Comhairle, we've also moved to strengthen our support to nursing homes, other long-term residential care facilities and home support, with focused actions to enhance the protection of staff and residents. These actions include infection prevention and control teams, really important teams that can go into our residential care settings and help support the work of staff, prioritisation of staff in these settings for testing, active screening of all staff, including temperature checks twice a day, ensuring personal protective equipment is supplied to long-term residential care settings and to home support providers, and the development of a preparedness plan across the sector. The National Public Health Emergency Team has a specific subgroup on vulnerable people is to provide oversight and assurance on the actions being taken to protect vulnerable groups, and representatives from other agencies and voluntary providers of services to vulnerable people do ensure that an integrated approach is now being taken. The National Public Health Emergency Team will meet again tomorrow, where I expect to receive a further update on the implementation of these new measures for the long-term residential care settings. This is a big public health issue we've got to get right. We have some of our oldest and most vulnerable residents living in nursing homes and other residential settings. We need to make sure that the safeguards are in place to protect them, but also to ensure that we don't see the risk of infection spreading from there into the community as well. COVID-19 continues to pose a very serious public health threat here in Ireland and right across the world. I want to stress again that this is a public health emergency. Our response to that emergency is being guided by the best international evidence and advice available. I'd like to take the opportunity to thank my colleagues in government for their efforts being made in their departments to support our efforts. I want to sincerely thank the Chief Medical Officer, back at work today and doing an incredible job on behalf of all of us and on behalf of our country, and all his team who work with him. I want to thank all members of this House for what I believe is a genuine constructive approach and the support that's been shown by members of this House for the public health measures. We all know this has not been easy, but people are answering the call to help our country through this crisis. We've been overwhelmed by the offers of assistance, the volunteerism, the community spirit, that famous Irish meill. We thank the people who are coming to work on the front lines despite the risks to themselves, and we most importantly also thank the people who are staying at home to lessen the risk to those people and to everyone else. We cannot stop this virus, but we can slow its spread, we can flatten the curve. Phrases that were unfamiliar to us just weeks ago are now a national catch cry that unites us: flatten the curve. Phrases that are now so overfamiliar, we wish we could all stop saying them, but we can't. Wash your hands, cover coughs and sneezes, keep your distance, stay apart, stay at home. Someday, Ceann Comhairle, they tell me we will get back to normal life, and I know we will. Although we also know we will not get there unscathed. On that day, when we look back, we'll look back at what we did. We'll look back at what we did now. And I hope we can say we did our damnedest. Yes, for our country, but most importantly, for each other. Gur Maith.